Swine flu, how to meet it and beat it. I'm Dr. Edward Thorpe, Cripps Pharmacy in Vancouver, British Columbia, Canada. We are a full-service pharmacy as well as an area of specialization, a subspecialization in herbs, supplements, vitamins, minerals, and other important parts, constituents of your body. On April the 27th, the World Health Organization declared the pandemic a level 5 pandemic out of a possible maximum number of 6. Many people are now concerned about the swine flu. Let me reassure you, this new strain, the H1N1 strain, is a particular strain which will not transmit from your pet pig to you. This is strictly a human-to-human type of viral transmission at this time, the most important type of transmission. And we have been working in this area for quite some time, so don't worry, you cannot get the swine flu from pork, from pig meat. Strictly a human-to-human transmission. And I have a few suggestions of how you can actually protect yourself against getting it, and if you do get it, what to do about it to get rid of it quickly. Remember, if you've got it, that means there's already mucosal or lining damage occurring in your body. So, as with any sore, if you have a sore, it takes a while to heal. So the best idea is not to get it at all. The symptoms you're looking for are the fever, coughing, joint aches, headaches, malaise in general, vomiting, and the various other typical flu symptoms. If you're suspecting that you're getting the flu, you might have a headache, for example, before your temperature even elevates. But elevated temperature is another factor that you can check. That means a fever. Wash your hands often. Carry a hand sanitizer with you. And put it on every 10 or 15 minutes if you're in public. If you're in the house, well, you can wash your hands, as often as you can remember. Dispose of tissues when you cough and sneeze and blow your nose, preferably by burning, otherwise in a safe manner so they cannot contaminate other people. If you're sick, please stay home. Don't pass this thing around. And definitely avoid large gatherings of people, because the percentage of a person having an infection is much, much larger, and it's not a linear thing. It goes up geometrically the larger the gathering of people. So it's definitely a situation to avoid. How do you prevent this thing? Well, of course, you wash your hands all the time. You avoid people that are sick. Stay out of hospitals, because that is the greatest concentration of sick people in the city that you're living in. And generally, you can pick up things from the hospital that you never would elsewhere. Vaccination. Well, I don't really particularly recommend that route, because people that get vaccinated get sick sometimes. There's always a small percentage. And this thing can lead to serious things like even paralysis. It's on record documented that you have a problem. One of my people that worked for me, one of my contractors, he actually had a flu shot several years ago, and he actually got sick. He was sick with flu-like symptoms for up to 14 days, and then the virus settled in his trigeminal nerve, and he's had pain in his trigeminal, that means in the face, the facial nerve. He's had pain ever since, and he can't get rid of it because it's a virus. Some of the things that will actually prevent the flu are things like vitamin D3 in large doses. This is the results of Dr. Cannell at U of C in California. He's a professor of medicine there, and he actually did the research, and this is published in peer-reviewed conservative medical journals. Other things are resveratrol, This is also published in a peer-reviewed medical journal. It's 85% effective. That was the conclusion of the paper that was published. 85% effective against the cold and flu virus. Garlic. Garlic has antiviral properties. If you do have lesions already, if it's attacking your mucous membranes, the lining of your esophagus, mouth, sinuses, lungs, bronchi, stomach, and intestinal tract, and yes, people do get intestinal, like diarrhea from the flu. Sometimes it happens more often, sometimes less, depending on the flu type. But that does happen as well. So, of course, symptomatic antidiarrheals will help. Any pharmacy has something that'll stop you up, like Imodium, for example. The other things that are extremely important as antivirals and help the body to heal, repair, regenerate are vitamin C. At least a gram of vitamin C, that's 1,000 milligrams, 4 times a day. If you have stomach ulcers and you can't take vitamin C, there is neutral forms like calcium and sodium forms of vitamin C that are easy on the tummy. We also have a slow-release vitamin C that is the actual ascorbic acid, so you're not adding sodium if you have high blood pressure. And this will not upset people with severe stomach ulcers because it releases a little bit over a 10 to 12-hour period. So there's a whole bunch of choices. And of these, probably fish oil is the most important because it maintains good mucosal condition throughout the body, and it's also great for the skin. So prevention is worth a pound of cure. We have other factors in here that are also antiviral, like lauric acid, monolaurin, we have DHT in capsule form, and a number of other things that I won't go into at this time because you've got enough on your plate to handle. These things that I've mentioned should be sufficient to give you a 95% confidence interval of not getting the flu if you're exposed to it. Generally, we can mail anywhere in the world. We are a full-service pharmacy. We can accept prescriptions from doctors and practitioners in the United States, now naturopaths as well. And just get them up to us, talk to our nice girls, and we can mail anywhere in the world, even the United States. Thank you. I'm Dr. Edward Thorpe from Cripps Pharmacy at 5413 West Boulevard in Vancouver, British Columbia, Canada.